What is immunosuppression after liver transplant? Imagine having a new liver placed inside your body and needing to protect it from your own immune system. That's where immunosuppression after a liver transplant comes into play. It involves using medications to lower the activity of your immune system so it doesn't see the new liver as a threat and attack it. Your immune system is designed to fight off infections and foreign invaders, but in this case, it might see the transplanted liver as something foreign and try to reject it. That's why doctors use immunosuppressive drugs to prevent this from happening. The liver is a bit special among transplanted organs because it has some natural properties that make rejection less common. It can send immune cells to the recipient, produce molecules that calm immune responses, and it can even regenerate itself. Still, even with these advantages, the immune system can sometimes recognize the new liver as foreign and attack it. That's why immunosuppressive drugs are essential for keeping the liver healthy and functioning well over time. After a liver transplant, the process of immunosuppression generally happens in two phases. The first is the intensive phase, which lasts about 3 months after the surgery. During this time, the immune response is at its strongest, so higher doses of drugs are used to prevent sudden or acute rejection. Once the risk of rejection decreases, the treatment shifts to a long-term or maintenance phase. During this period, the doses of medication are lowered to help the immune system tolerate the new liver while reducing side effects. The goal of immunosuppression is to find a delicate balance. You want enough suppression to prevent rejection, but not so much that your body becomes vulnerable to infections or other complications. Sometimes, in rare cases, the immune system may accept the new liver without ongoing medication, a state called operational tolerance. But this is uncommon, and most patients need lifelong management. Several types of drugs are used to achieve this balance. Calcineurin inhibitors like tacrolimus and cyclosporine are the most common. They work by blocking a key enzyme that activates T cells, which are immune cells responsible for attacking the transplant. Tacrolimus is usually preferred because it's more potent. Corticosteroids are often used initially to reduce inflammation and immune activity. Other drugs like mycophenolate mofetil inhibit the growth of lymphocytes, helping to prevent rejection. Sometimes, specialized biological agents are used to target specific parts of the immune response. Because these medications weaken your immune defenses, patients need careful monitoring. Doctors regularly check drug levels, kidney function, and signs of infection. Adjustments are made to keep the immune system suppressed enough to protect the liver but not so much that it causes harm. This ongoing management is vital for long-term success. In the context of liver health and liver cancer, immunosuppression plays a crucial role. While it helps prevent rejection, it can also increase the risk of infections and, in some cases, the recurrence of cancer. That's why transplant teams tailor each immunosuppressive regimen to the individual, considering their health history and risks. The ultimate goal is to keep the transplanted liver healthy and functioning while minimizing side effects. In summary, immunosuppression after a liver transplant is a carefully planned and managed medical approach. It involves using specific drugs to suppress the immune system, just enough to prevent rejection while preserving overall health. Always remember, managing this balance requires close medical supervision, and anyone with a transplant should work closely with their healthcare team to ensure the best possible outcome. If you or someone you know is considering or has had a liver transplant, consult with medical professionals for personalized advice and ongoing care.